Now I will explain about PTSD. I'm sure you've heard of this disease at least once. The table of contents will cover definition, symptoms, causes, and treatment, and some link between COVID-19 and PTSD. So PTSD is short for post-traumatic stress disorder. It is immediately identified in its name as what disease it is. So PTSD causes terrible events and shocks in the past, such as the part post-traumatic. There are terrible events including natural disaster, a serious accident, a terrorist act, and war combat. Therefore, PTSD is a disease caused by intensifying anxiety and stress caused by these events. So how many people does this PTSD occur and what rate? While most currently available statistics measure the rates of PTSD in adults, the disorder can affect any age group. While the overall past year prevalence of PTSD in adults is estimated at 3.6%, the numbers indicate that PTSD is far more common in women than in men. People with PTSD have intense, disturbing thoughts and feelings related to their experience that last long after the traumatic event has ended. They may relive the event through flashbacks or nightmares. They may feel also sadness, fear, or anger, and also feel detached or estranged from other people. And people with PTSD may avoid situations or people that remind them of the traumatic event, and they may have strong negative reactions to something as ordinary as a loud noise or an accidental touch. So we can summarize the symptoms of PTSD by four types. First one is extrusive symptoms, and second one is avoidance, and third one is hyperarousal, and last one is change in thoughts and feelings. So how does this kind of PTSD happen? In fact, explaining the definition earlier, we look at approximately why PTSD occurs. So PTSD occurs depending on whether you have experienced trauma due to psychological factors, how your mental health condition is, and how much stress you have been under. In addition, how exposed to trauma is also a risk factor that can cause PTSD. And there are also biological factors which cause PTSD. So first one is hyperactivity of the sympathetic nervous system. As we studied before, the sympathetic nerve system make our bodies flight or fight, leading to an excited state of quickness, tension, and perspiration. In PTSD, even minor stimuli are greatly surprised and overreacted because this sympathetic nervous system reacts greatly to minor stimuli. So we can call this situation like paroxysmal sympathetic hyperactivity. So it is a syndrome that causes episodes of increased activity of the sympathetic nervous system. Hyperactivity of the sympathetic nervous system can manifest as increased heart rate and increased respiration, and also increased blood pressure, diaphoresis, and hypothermia. And the second most well-known cause is abnormality of hypothalamus pituitary adrenal axis. So first we need to know what this mechanism is. So HPA axis is a complex set of direct influence and feedback interactions among three components. So this picture shows that the step of this mechanism well. Regulation of the hypothalamus pituitary adrenal axis by glucocorticoids plays a major role in stress response and is known to be epigenetically regulated. So this mechanism should only appear in our body's crisis. But however, in the case of PTSD, this mechanism is excessively activated without need. According to this mechanism, so excessive secretion of norepinephrine will awaken your body and make you feel anxiousness. And this is some addition point. So relation of DNA methyltransferase 1 and PTSD. So DNA methyltransferase 1 belongs to a family of proteins known as DNA methyltransferases, which are enzymes that add methyl group to DNA. So on epigenetic mechanism, DNA methylation is intrinsically linked to gene expression in response to environmental exposure such as trauma. So additionally, DNMT1 gene locus has increased methylation in individuals who were exposed to trauma and developed post-traumatic stress disorder. Although not all of these genes are mentioned due to lack of time, but these various genes cause PTSD, like SLC6A4 or some NR3C1. And next one is treatment. It is important to note that not everyone who experiences trauma develops PTSD, and not everyone who develops PTSD requires psychiatric treatment. So there are these types of psychotherapy, CPT or exposure therapy, and eye movement sensitization and responses. And psychotherapy is usually conducted on patients who have found some stability through medication. So there are some medication of SSRI, Sungmin mentioned, and some anti-anxiety medications. So now I will talk about relation of COVID-19. So COVID-19 has increased the frequency of various psychological diseases caused by psychological anxiety. So in particular, PTSD, one of the anxiety disorders, has also increased in frequency due to COVID-19. As the intensity of psychological impact of the COVID-19 pandemic is increasing worldwide global data, epidemiologists expect a significant increase in total prevalence of PTSD, with the risk for women being twice as high as that for men. Yeah. So the COVID-19 pandemic has the potential to increase stress and anxiety, both because of the fear of infection and because of uncertainty about how the outbreak will affect people socially and economically. Yeah, so PTSD explanation is the end, and now Jongmin will introduce about boredom.